It's an honor for me to work with people in their like most vulnerable states. I believe only people who are compassionate and really wants to do that should be able to work with people in this state, because people are really, they're scared, they're vulnerable, they don't know what's going on most of the time. So that's why I went into it. Passion. I'm Ranzi, and I am an orthopedic nurse at Houston Methodist. I've been at Houston Methodist for about 6 months now. Let's go. Shift report is important so that we can know, for one, what the patient is there for, what's the status of their condition, and if they had any critical results or any changes that we may need to know. I like to say what I like most about orthopedics is just the patients that I experience. It's a lot of them are older population, and I enjoy the stories.
Show them a picture of the dogs. The girls, one is Winter Princess and the other is Elle from Legally Blonde, because I was directing the musical Legally Blonde when we got Elle. And they have matching little outfits when they go to the theater. So anyway, my stay here, it has been really wonderful. Everybody is so nice. And what they have here, I like, the nurses and the doctors, is empathy and compassion.
I love this floor. It's not true med-surg. More surgical, and I like the population because we deal with, a lot of replacements, knee replacements, hip replacements, and just bones in general. It's pretty interesting. I never thought I'd be in orthopedics, but I enjoy it, and I also enjoy my coworkers. Management is great too, so I think I chose a good spot. I love my colleagues. They're so supportive. Even when days are really hard, just being around them makes it just 10 times better. Like, I know it's gonna be a hard day, but I got my family here because they're like family.
Ranzi is super fun. Her and I relate very closely to each other, and she's pregnant, and I'm so happy for her.
She has this positivity. Even when she's maybe overwhelmed or she has a lot going on, she's still gonna smile and crack a joke. And I really appreciate that aspect of her personality.
It was wonderful precepting Ranzi. She's like a little sister to me.
Ranzi is very good. She really is not aware of how good she is. She's new to the game. She was just in the office the other day saying, "Miss Quita, I just don't know. I feel overwhelmed." I'm like, "Ranzi, you've only been nursing for 6 months. I mean, what do you expect? I think you're doing a fantastic job." So she doesn't really understand or know her own strengths, but once she gets the hang of everything, I think she's gonna be a phenomenal nurse.
As far as what's next, I think right now I'm just focused on honing my nursing skills. That's it right now. Yeah, because it's still a little bit stressful. I have 5 patients today, and when I first started, that was like my worst fear, of getting 5 patients or more. 4 was like, okay, I can manage it, but 5 kind of took me over the edge, but it's getting easier every day. Some days are better than others. I get home, take a shower, and make my fiance rub my feet. And I talk about my day with him. And it's satisfying going home like I made it through the day.